Hello, myself Rama Bandari. I'm going to do presentation about Jaren's case study. My presentation focuses on the importance of cultural safety in healthcare using the case of Jaren, a 5-year-old Aboriginal boy who was admitted to the hospital with acute asthma. Respect of culture is an important part of quality nursing practice, which plays an important role in improving health and well-being among children and families from different kind of cultural background. Culturally safe healthcare improves health outcome for Aboriginal and Torres Strait Islander children by building trust, enhancing communication, and supporting family engagement in care. Case study of Jaren. Jaren is a 5-year-old Aboriginal boy from Northern Territory community, and he presented to the hospital with acute asthma exacerbation with severe wheezing, shortness of breath, and oxygen desaturation. His mother speaks limited English, which is Yellow Matha, it's his first language, and his father is an elder. And they felt isolated and disoriented in a metropolitan hospital environment. Jaren's asthma is usually well managed at home, but seasonal changes triggered this acute episode. His mother accompanied him, but speaks limited English, which created communication challenges. Being far from their country and community, both Jaren and his mother felt isolated and uncomfortable. This situation highlights how healthcare setting can unintentionally feel unsafe or unfair for Aboriginal families. Importance of cultural safety. In here, I'll discuss about recognize cultural identity, belief and language, discrimination and racism, build trust and family engagement, and improve clinical outcome. Culturally safe healthcare is necessary for providing equitable health and well-being among children, adolescents, and families from different cultural backgrounds. It includes recognizing and solving inequality of power, racism, and different cultural identity to provide healthcare that's respectful, empowering, and free from discrimination. Culturally safe healthcare were found to involve supportive healthcare systems that are sensitive to the cultural knowledge, belief, and the values of indigenous people. Culturally safe healthcare provides visible improvement for clinical outcome, patient engagement, and psychological wellness by changing the way children, adolescents, and their family interact with health services. When families feel respected and understood, trust increases so that the patients are more likely to follow treatment plans and provide important clinical and social information and attend follow-up appointments, which help to lower the risk of acute exacerbation, readmission, and preventable morbidity. Practically, culturally safe delivery improves communication and health literacy through the use of interpreter, First National health professionals, and bicultural advisors and culturally appropriate communication method. Culturally safe care also address emotional and social aspect of well-being by understanding the importance of family, community, and nation. Healthcare providers can reduce the isolation, anxiety, and trauma that children, caregivers, and adolescents experience when they separate from community surrounding while in the hospitalization, which will help them adjust and recover. Overall, culturally safe healthcare provides physical, emotional, and social well-being in children and adolescents from different backgrounds by empowering families, supporting equitable access, and building trust. Threatening factor. In here, first of all, I've discussed about communication barrier. Communication barrier is one of the most significant threats and communication challenges. Jaren's mother primarily speaks Yellow Matha and has limited English, so it's hard to understand everything. The language and cultural needs of Aboriginal patients can be more helpful by improved system procedure. For providing advice on this, Aboriginal interpreters are in a unique place. Emotional distress and racism. Emotional distress and experiencing racism while getting care can cause further difficulties. Being away from their community and traditional practices, Jaren and his mother may experience isolation, anxiety, and stress, which can delay recovery. Respectful, understanding, person-centered care is likely to improve the hospital experience, lower the chance of self-discharging, and meet patient needs. Also, Indigenous people daily experience of racism and discriminatory behavior so that the patient become more distressed and they get negative impact. Lack of cultural training among staff. Hospitals that follow and maintain cultural safety policies can provide an environment where Aboriginal families are respected and supported. Cultural training and knowledge provides healthcare provider for critical self-reflection and solution for cultural clinical encounters, which may help to improve culturally safe care for Aboriginal health. If the healthcare provider get education about Aboriginal culture, they can provide better care for Aboriginal people. Because of that, they understand how to provide care so that the patient will feel respected and share their health problem. Therefore, limited culturally competent staff can be a barrier. Supporting factor. Culturally safe care improves trust and engagement. Aboriginal people and other people from different cultural background will feel respected if they get culturally appropriate care, so that the child and adolescent trust healthcare providers. They feel valued, communicate nicely. Culturally safe environment can help health professionals to provide better services and good health outcome. If we provide culturally safe care, in this case, Jaron and his family would not feel anxious, isolated, and uncomfortable. Another one is equal care. Equal care makes sure that all children receive the same level of respect, care, and treatment without any discrimination. In Jaron's case, equal care means that the healthcare provider respects his family cultural identity while providing the same level of clinical care. To achieve the equity care, the NCF systemic and the policy changes that they specifically target the needy infant and children. Family involvement in care plan. Involving the family and the community into the care planning ensures that the treatment is in accordance with cultural norms, increases the parental self-confidence, and increases healthcare participation for successful outcome. When involving family in the care, then the patient feels supported and the family can provide better care at home if needed. Multidisciplinary team roles. Nurses, pediatrician, Aboriginal liaison officer, interpreter, and social worker plays an important role to provide quality care. Professional team member can provide Jaron with culturally safe care. It requires a coordinated multidisciplinary teamwork to provide Jaron, a 5-year-old Aboriginal child with acute asthma, with culturally safe health care. Each professional shares specialized knowledge that supports the clinical, emotional, and cultural well-being. Registered nurses play an important role in assessing Jaron's respiratory rate, monitoring saturation, and administering him with his prescribed drug. Beyond their clinical responsibility, nurses act as advocates, making sure Jaron's mother understands his treatment and their cultural values are respected. According to the study, healthcare systems include implementing organizational wide cultural safety procedure with monitoring and evaluating outcomes. Indigenous people opinions to be heard at all levels of the healthcare organization and addressing racist or discriminatory behavior and practices. Aboriginal liaison officer is essential in this scenario. The ALO supports communication between family, hospital staff, and provide cultural guidance to the healthcare team and help Jaron mother feel connected and supported in an unfamiliar environment. Aboriginal health worker and liaison officers professionals can improve communication between patient and medical staff and improve care, decrease patient discharge against medical advice, and help to provide quality care. The pediatrician manages Jaron's medical treatment. Social worker officers offer emotional and psychological support and practical support like transport, Aboriginal community services. The interpreter services ensure clear communication, which is for consent and to prevent misunderstandings. Professional team members work together to make sure Jaron and his mother receive treatment that is clinically effective, emotionally supportive, and culturally respectful. The team improves cultural safety and helps Aboriginal children and families have better health outcomes by including Aboriginal health perspective in hospital environment. Conclusion. Culturally safe care enhances clinical, emotional, and cultural well-being. In conclusion, Jaron's case highlights the importance of delivering culturally safe healthcare to Aboriginal children and their families. Effective care extends beyond a medical treatment. It requires understanding cultural identity, language, and emotional well-being. Implementing culturally safe practices such as using interpreter, involving Aboriginal liaison officers, and promoting equal care ensure that families feel respected, supported, and empowered. Multidisciplinary collaboration among nurses, pediatricians, social workers, and Aboriginal health professionals enhance trust, communication, and holistic well-being. Furthermore, addressing barriers such as language difficulties, racism, and lack of cultural training fosters an inclusive environment that promotes healing and family engagement. Through respectful and culturally responsive care, healthcare professionals can improve health outcomes, reduce inequality, and strengthen relationship with Aboriginal community. Overall, culturally safe care not only benefit individual patients like Jaron, but also contribute to more equitable and compassionate healthcare system for all children and families. Thank you for today's. I have submitted my references in my script.